Good morning, everybody. Good morning. I'm very grateful that you joined us this morning. Let me just introduce the folks who are here. Tanya Anthony is our Bureau Chief for the Bureau of Administration. Dr. Rachel Rubin is co-leader of our Cook County Department of Public Health. Sean Morrison is a commissioner. Deborah Sims is a commissioner. Lizzie Rangel is our sign language interpreter, along with Michael Albert. We have Commissioner Aguilar, Eddie Borraio, closer, all right, who's President and CEO of Rincon Family Services, Mayor Cuspa, and Bill Barnes, our Director of the Department of Emergency Management and Regional Security. And we're expecting shortly Deandrea Paxton, who's co-founder and director of the Harvey Area Chamber of Commerce, and Commissioner Johnson. So I want to thank all of the community leaders and elected officials who are here with us today at the county's Emergency Response Center in Oak Forest. As we begin the press conference this morning, more than 145,000 people in Cook County have contracted COVID-19. More than 5,200 have succumbed to the virus in just over 6 months. One death is too many. 5,200 is a tragedy. I believe that it's government's responsibility to ensure our residents' safety and security. We do this by providing the resources and information they need to stay safe. Science tells us that a mask, a simple mask, can literally save lives as we continue the battle against COVID-19. If our residents are provided with masks and use them, we can remain healthy and keep those who come into contact with us healthy. While many of our residents are able to afford masks, others cannot. That's why Cook County's Department of Emergency Management and Regional Security purchased more than 500,000 masks, that's 500,000, for our most at-risk and underserved residents. We've partnered with community organizations and municipalities across Cook County and have already begun this critical distribution, delivered by county's Department of Transportation and Highways. Representatives from two of our partner organizations, the Harvey Area Chamber of Commerce, along with Rincon Family Services, are here to talk about just how important this initiative is. But the masks alone are not enough. Every single member of our community can make a difference. Every single member can make a difference as we work to eradicate this virus. We're more than 6 months into the pandemic, and the changes we've had to make have at times been very difficult. But they're vital to our success. We must continue to reinforce the importance of wearing masks, washing hands, and watching our distance. That's why, in conjunction with this mask distribution, we're continuing our Mask Up Cook County education campaign that was initially launched by the county's Department of Public Health. While we are targeting all of our residents, we're focusing more closely on those who are in our communities that are hardest hit by the pandemic. That is, our Black and Brown communities, and our residents for whom English is not the first language. We want to ensure that those who need this information get it. We've engaged Flowers Communication Group for this campaign, and the advertisements you see here today are the first in a series that will be created in multiple languages for outlets throughout Cook County. I can't stress enough that each and every resident of our community has the power to help us eradicate COVID-19. We must work together as one Cook County to ensure the safety of our loved ones and our neighbors. We can't do it alone, but we can do it together. Join me as we mask up. Commissioner Sims?
Thank you, Madam President. As the President ended on Mask Up, I think that's important that we get the word out to everybody. And wintertime is here. I mean, it's cold today, and people are, you know, it's hard to wear them in the summertime, and I know it's probably going to even be harder in the wintertime, but we must stress how important it is that everybody wears a mask, regardless of where you are. You know, people are wondering how they're going to dine out, you know. So it's important. So I'm thinking that as people start to figure out, are we going to eat inside or outside, they're going to find a way to not wear masks. But I think with us banding together and make sure we get out the word that everybody should mask up. And thank you, Madam President, and all of your staff for making sure that the masks, we have enough masks. Bill Barnes and Emergency Management make sure that there's enough masks that we can pass out to those people who really need them. So thank you all, and thank you all for coming.
Thank you. Commissioner Morrison.
Thank you, Madam President, and everybody that came here. The message is really simple. COVID-19 is a real deal. Putting on these masks will absolutely help, and this is what good government does. Good government looks to be able to provide resources to those that are underserved in our community. So I applaud the President and all those that are leading this charge. Remember the message, wear a mask. Thank you all.
Commissioner Aguilar.
Thank you, Madam President. We must be vigilant, especially now. This is flu season. So it's critical that we all wear our masks because you don't know how far this infection can spread. So I'd like to thank Madam President and the board and for their support, and Bill for taking this initiative. Thank you very much. La importancia de tener su máscara es muy importante, especialmente ahora porque la epidemia del flu llega en otoño y en invierno. So es importante de estar vigilante en la infección. Le quiero dar gracias a la Madam President, a Preplico y a Bill Barnes por tener esta iniciativa. Gracias.
Thank you, Commissioners. Now we'd like to hear from the Mayor of Oak Forest, Henry Cuspa.
Good afternoon, everyone.
Good afternoon.
Madam President, I want to thank you very much for allowing the Southland communities to benefit from this very generous offer. I'm honored to represent many of the Southland mayors here today, and we look forward to a very good partnership. Masks are important. They're the easiest way to fight COVID. Every one of our communities, we have lost valuable residents. And like the President said, losing one person is too much. So help us promote the mask program and help us get them out to the communities and the residents that truly need them. And again, Madam President, thank you very much for allowing us to participate.
Thank you, Mayor. Bill, I believe you're up. Bill Barnes, who's Director of Emergency Management and Regional Security.
Thank you, Madam President, and good afternoon, everyone.
Good afternoon.
You know, I'd like to start off again with a thanks to Madam President for her leadership as we have sort of charted a path through the early months of this pandemic. So thank you for that leadership. Also like to thank the representatives of the board here whose support was very important as we allocated the resources necessary to engage in initiatives like we're presenting today. Thank you, Mayor Cuspa, for your support. I'm very happy to help you and the mayors that you represent. And of course, I'm eternally grateful for Cook County Department of Public Health and their representatives. Dr. Rubin will be speaking to you shortly. Dr. Rubin and Dr. Joshi and their staff have been lockstep with Cook County's Department of Emergency Management, Regional Security, and the Emergency Operations Center as we as a county have responded to this crisis as it has evolved over the past months. As President Preckwinkle indicated, the safety and security of our residents is paramount, and it speaks directly to the mission of my department at Emergency Management. My team began to mobilize resources and response in January as the first cases began to crop up in the nation. And we worked closely with our colleagues at the Department of Public Health, as well as other county agencies, and local municipalities, and representatives of the federal and state government as well. To begin with, we secured much-needed personal protective equipment for first responders and frontline healthcare workers when severe shortages swept the nation. We worked with the medical examiner's office to stand up a surge center to handle what was anticipated to be a surge in fatalities as they began to appear throughout the county. We also worked with our partners in the county to stand up respite housing for those individuals and professionals in our county who could not quarantine in their own houses. And now, as this pandemic enters its 7th month, we must ensure that the most vulnerable residents in our communities have the resources they need to help us all slow and ultimately stop the spread of this virus. As President Preckwinkle so rightly pointed out, something as simple as a mask can mean the difference between life and death. But unfortunately, not everyone in the county can afford a simple mask. In county government, we always stress that your skin color and zip code should not determine your ability to survive, be it a pandemic or other crises. And those things should not determine your lifespan as well. And that's why we as a county undertook this initiative to provide masks to those residents who most need them in response to this pandemic. Working with public health, we determined those areas of greatest need throughout the county. And that was using the COVID-19 Community Vulnerability Index. It's represented here. And what the CCVI does is it considers social vulnerability indicators such as socioeconomic and minority status, disability, language barriers, housing type, and access to transportation, and identifies those communities that are at the highest risk. It prioritizes them. Based upon this effort, we have determined 18 of the most high priority communities based on their needs. And those communities are Blue Island, Bridgeview, Chicago Heights, Cicero, Dixmoor, Evanston, Harvey, Markham, Melrose Park, Northlake, Phoenix, Posen, Riverdale, Robbins, South Chicago Heights, South Holland, Stone Park, and Summit. Now, in order to reach those most vulnerable populations within these communities, we have partnered with several nonprofit organizations and the local governments themselves in these communities to ensure that the masks get in the hands of those that need them the most. You'll hear from 2 of those organizations in a moment. Now, in order to make sure that these masks get out to the populace, we couldn't do that without the Department of Transportation and Highways. It's our DOTH employees at the county who are making sure that the masks get distributed to those folks who have been tasked to get the masks out into the communities. Throughout this pandemic, we've worked to identify the needs in our communities, and we've done all that we can to meet those needs. But we as a county government can't do it alone. We need your help. All of the county residents must work together in order to slow and stop the spread of COVID-19. Follow the science. Wear a mask. Wash your hands, and watch your distance. Our education campaign, which was mentioned by Madam President, will continue to reinforce these simple steps. And they will be done in multiple languages and on multiple platforms to ensure that everyone hears the word. And I know our residents will continue to step up and do their part because we are stronger together. We are one Cook County. Thank you.
Thank you, Bill. Commissioner Johnson, you want to say a few words? All right, Deandrea Paxton, who's co-founder and director of the Harvey Area Chamber of Commerce.
Good morning.
Good morning.
I apologize, my glasses steam up when I have the mask on. My name is Deandrea Paxton. I am the co-founder and now director of the Harvey Area Chamber of Commerce. I want to thank President Periwinkle and all of her staff, which have been just very courteous and sensitive to what's happening in our communities, as well as they have just followed up and followed through with this entire process and getting the masks to the community. The HACC has begun this initiative, Mask Up for a Healthy Harvey. And I would also like to take a moment to thank all of our board members, sponsors, and supporters and community partners for joining us in the process to stop the spread of COVID-19 in our communities. The Harvey Area Chamber was formed in 2004 and has advocated concerns with socioeconomic and imbalances affecting for-profit and not-for-profit businesses and residents in the city of Harvey and its vicinity. COVID-19 and civil unrest, as we know it, has amplified the need to not only discuss negative impact, but the extreme measures to start the process of reforming public policy and private partnerships to immediately address the oversight. Although there was no foresight on a COVID-19 pandemic, I personally participated in numerous focus groups that were put on by President Periwinkle and her staff from 2011 leading up to the policy roadmap, which played a great part in getting this whole process on its way. Because we all know, as an urban planner, I know that things have to be put on paper. They just can't be spoke on. They have to be put on paper. That policy roadmap named everything that we needed. The staff, once again, heard the community as it pertains to the social economic disparities, racial inequities, and numerous things as it pertains to underserved communities in the Southland area. So I thank you for that. The Harvey Area Chamber of Commerce Mask Up for a Healthy Harvey initiative reinforces HACC's mission as an economic advocate motivating social reform when announced on September 14th of this year, Mask Up for a Healthy Harvey. We only had 635 Harvey COVID cases per publication by the Cook County Department of Health. As of September 28th, the CCDPH reported Harvey COVID-19 cases at 682 cases in the city of Harvey. That's 3 days ago. Since March, our cases have risen from 3 to 5, and now 10 reported cases per week. The city of Harvey is a 6.3-mile radius area. According to these numbers, that is one person infected per mile with COVID-19 in the city of Harvey. If we don't work together at the current rate, 10% of the city of Harvey in the next 12 months will have COVID-19. These masks were so important, and it was so important that we got the masks there. We're thankful for the 20,000 that was delivered and the promise of another 20,000 in the city of Harvey. We've created PPE kits to give out. Thus far we've given out 2,000, and the other ones are accounted for. So moving forward, we would just like to thank our Cook County President and all of the legislators that have put forth the effort to help the city of Harvey and surrounding communities that are in need for these masks. Thank you.
Last but not least, Eddie Borraio, President and CEO of Rincon Family Services.
Good afternoon, everyone. My name is Eddie Borraio. I am the President and CEO of Rincon Family Services. I want to first thank President Toni Preckwinkle for her dedication, commitment to all communities in Cook County. I also want to thank the Board of Commissioners, but in particular, our Commissioners, Luis Arroyo Jr., Commissioner Alma Anaya, and my Commissioner, Frank Aguilar. And your team, for this initiative you're about to start that will safeguard thousands of families that are essential workers across Cook County. I remember being at church with my family on the eve of New Year's, as many Americans woke up to that beautiful cold January 1st that no one knew that this 2020 would usher once-in-a-century pandemic that has changed the world as we knew it. COVID-19 has touched all of us. I'm a proud borough resident of 16 years with deep roots in many communities because of my employment. At times, it is difficult to listen to each story of the lives lost to this deadly disease and the families that have nowhere to go for resources. Countless stories, each with a name, each with a dream not fulfilled. But we are a resilient community that does not take no for an answer. Today is October 1st, 7 months into the pandemic, and over 200,000 dead and counting. As the CEO of my organization, I mobilize a coalition and resources to combat the negative education as it related to COVID-19 and launch Operation Counting Lives, Saving Lives. This was the first of its kind approach to intertwine two important goals: educating the community on the 2020 census, which is vital for our county and the state. Second, educate the community about proper usage of PPEs and how to use PPE in a safe and most convenient way to stop the spread of COVID-19. The goals are simple as meeting the people where they congregate and having trusted voices and familiar faces to educate and promote safe PPE usage. We've distributed 5,000 8-ounce liquid sanitizers, over 30,000 disposable face masks, 7,000 reusable face masks. I know that COVID-19 has impacted all communities, but our Latino communities have been devastated. Our community is hurting and it needs resources now. As a result, we created multiple initiatives to address this growing need, but also Rincon has joined Illinois Unidos as one of the first organizations to support the core premise of the group that states, to present one united voice in stopping the growth of COVID-19 in our communities while addressing the related public health issues and the devastating economic impact in the Latino communities. These masks represent a strong step forward and commitment from your administration, Madam President. President Preckwinkle, on the importance of the Latino community, because we matter and we count. So many not like it, but we are an economic engine for cities like Cicero, Berwyn, Summit, Melrose Park, Hanover Park, just to name a few. Again, these masks represent hope, resiliency, and another step forward in making sure that our working families are safe and protected in the midst of this unprecedented pandemic. Rincon Family Services believes that it's in the spirit of collaboration, partnership, servant leadership, and self-determination that we can truly elevate and move forward towards an agenda that is equitable and inclusive. Thank you, Madam President, for stepping up and stepping in to stop COVID-19 at its tracks. Our community is thankful. Thank you, and God bless.
Thank you. So, I was wrong. Thank you. I neglected to acknowledge our own Dr. Rubin, who is co-director of the Cook County Department of Public Health, who has a few words to say as well.
Thank you, Madam President. The Health Department, we are so excited and so happy to partner with President Preckwinkle on this Mask Up Cook County campaign, and I also want to acknowledge the incredible partnership with the Department of Homeland Security, your Emergency Management. This is what happens when you're a little nervous, you say the old title. So Emergency Management, and our great partnership with Bill Barnes and his staff. I appreciate the support of the commissioners that were able to come out here today, as well as the incredible community partnerships with local municipalities and community organizations for this Mask Up Cook County campaign. So the campaign is designed to encourage young adults to help us in the fight against COVID-19 by wearing their masks consistently and correctly. We did this in response to a 250% increase in positive cases between late March and July. We continue to see the most growth in people in their 20s and 30s, as well as teens. We have also been keeping a watchful eye on school cases and outbreaks transmitted in the community in school-aged children. So far, in our jurisdiction of suburban Cook County, we have had over 100 schools with at least one confirmed COVID-19 case. Almost all of these cases have been due to transmission in the community and not in the schools themselves. A few schools have met the CDC definition of an outbreak, which means at least 2 confirmed cases in one location, where transmission appears to have occurred during in-person learning. But the vast majority are school children or teachers or staff that are infected in the community, and then they go to work without knowing that they're sick. The metrics for our region are currently stable, but we are heading into flu season as well as colder weather that will drive people indoors, and this could increase the transmissibility of disease, not to mention the increase in seriousness of illness for those that contract both influenza and COVID-19 at the same time. Masking has been proven to be effective in helping to prevent the spread of COVID-19. Masks save lives. Universal masking is what is needed to stop COVID-19 and allow us to return to normal movements and our activities. This fall and winter, we need everyone over the age of 2, to always wear their masks consistently and correctly, covering the nose and the mouth, when around others that are not in their own household. We need to mask in combination with getting a flu vaccination, hand washing, physical distancing, and staying home when sick, and we will get through this sooner rather than later. So mask up, and thank you all very much.
Thank you. All right, I understand that, thank you very much, Dr. Rubin. I understand that Alice is on the phone, is that right, Alice?
Yeah, I have an off-topic question.
Okay. Nick, is there anybody else on the phone besides Alice?
I believe that's it, or we can have an additional question. Email.
Yes?
Take Alice first.
Alice has an off-topic question, so let's start with the on-topic questions.
We have one question about social vulnerability index, it's like for Dr. Rubin, and how these communities will determine CDC.
All right, so the question was about the social vulnerability index, Dr. Rubin?
This index is designed to take into account a variety of socioeconomic factors that are then analyzed on a local level to determine like a score. And the worse your score, that means the more vulnerable you are. That means that there is insecurity in housing, insecurity in food, low income, unemployment. So all of these factors are put together into a matrix, and there are weights for it, and it comes out. And the most vulnerable communities then come out with the worst scores. And we're able to do that on a zip code level, and therefore, zip codes then correspond to different communities, and then those that are ranked the worst are the ones that are most at need, and that's how we determine where to target our interventions.
All right, thank you. Nick, did you have any other questions? Is there anyone else on the line besides Alice? Hearing none, Alice, you get to ask your off-topic question. I'm sorry, could you repeat it, please?
Yeah, do you have any updates on Halloween 2020, such as safe trick-or-treating guidelines?
All right, the question is Halloween 2020. Do you have any guidelines for safe trick-or-treating, Dr. Rubin?
Yeah, you know, I'm so grateful that the state came out with Halloween guidance a month ahead of time, or 4 weeks ahead of time. No haunted houses. No haunted houses. You can't wear, you know, a ghost robe or, you know, a ghoul mask. That's not sufficient. You have to wear a regular mask that is meant to prevent transmission of COVID. So you have to wear cloth or disposable masks. You can wear them underneath your ghoulish mask, but you've got to wear masks maintaining 6-foot distance. If you're going out to go trick-or-treating, please just go with your own household, and what is suggested is that families or homes that are putting candy out, to put individually wrapped candies out in a bowl for people that can come pick them up as opposed to handing it to them. And it's also required that when you come home and your children have buckets full of candy, that they wash their hands before they start to partake of the treats. And there is a full set of guidance that has just been released by the Illinois Department of Public Health, and it is up on their website, and we will also put a link to that on our website as well. So the idea is to use common sense, maintain the social distancing, only trick or treat with your own household, wash your hands when you come home before you enjoy the treats, and wear masking at all times while you're out.
All right, Alice, do you have any further questions?
I was wondering, in terms of haunted houses, which are prohibited, what does enforcement of that look like? Who's in charge of enforcing that?
Dr. Rubin, she wants to know who's in charge of enforcing no haunted houses.
If we get a report of a haunted house either in operation or planning to be in operation, we would notify the local municipality where that haunted house is located or potentially located, and we will ask for local law enforcement or local government cooperation to ask them to desist.